Sleep disordered breathing is more common than people think. Sleep apnea is affecting like 1 in 5 adults in the United States. When we stop breathing, when we sleep multiple times in an hour, it creates a lot of stress on the body. Your heart's stressed, your brain's stressed, and it ends up being very correlated with like diabetes, heart disease, dementia. So it's something that is hidden for some, but it's really important to investigate and treat. How we treat sleep disordered breathing at Smile House. Part of our mouth mapping diagnostics includes a CBCT X-ray. So that's a 3D X-ray of someone's head. I see the nasal structures, I can see the airway. That just gives us a clue to what they're dealing with physically. And from there, we run through some questionnaires to see what the symptoms are. Based on what we find with their physicality, their symptoms, their history, their health history, how are we going to treat this? There's always several options, so we walk through each option for each person. A multidisciplinary approach to sleep disordered breathing often involves an orthodontist, could involve a surgeon, definitely involves a sleep doctor. We run a sleep study test with a sleep physician to really determine what's happening with the patient. And then I work with my colleagues. Is ortho expansion going to help them? Is surgery going to help them? We find out what's best. If the patient is ready, we can also use an oral appliance therapy, which is like a special night guard to help them open the airway when they're sleeping. One of the treatment options at Smile House for sleep apnea is a mandibular advancement device, an MAD. That is a special night guard that's going to open the airway physically by moving your lower jaw forward. That's done very slowly. We use specific parameters because we also don't want to cause any discomfort for the patients, and we want them to enjoy sleeping without pain and suffering. I've had patients that were really struggling to feel good in the day. They were struggling, they were not sleeping well, their immune systems were down because of the lack of sleep, etc. And so I've had the opportunity to improve someone's sleep when they had sleep disordered breathing. Not only is it changing their relationships with their partner because both of them are sleeping better, but they really are able to show up differently in their day when they're feeling good.